liver biopsy, what to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Pradaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manages your warfarin or the anticoagulant closely to you have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take the lobanol injection, you need to follow your doctor who manages your warfarin or the anticoagulant instructions closely. Make sure you understand when you need to start the lobanol injection, when you need to stop the lobanol injection right before the procedure, when you need to resume your lobanol injection after the procedure, when you need to completely stop the lobanol injection therapy. If you are taking Eliquis or Xarelto or Pradaxa, you should check your kidney labs. Make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you may need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Pradaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Eliquis, Xarelto, Pradaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you might need to delay resuming your Eliquis, Xarelto, or Pradaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulant so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication. Please let me know in the comment box below. Thank you. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan reach with a lower node injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower node injection, you should follow the instruction from your doctor who managed your warfarin or the anticoagulant to make sure you understand when to start the lower node injection, when you need to stop for the procedure, when you should resume your lower node injection. If you are taking the Eliquis, Xarelto, or Adaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need hold your Eliquis, Xarelto, or Adaxa more than 2 days. If you have normal kidney function, then you might need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who managed your platinum medication or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Xarelto, Adaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manage your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question, concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you.